God bless you. I'm Bishop Maynard, the pastor of Cathedral Praise Church right here in Nashville, Tennessee, 4300 Clarksville, Pike. Invite you again for this discussion time that we have been having on Sunday night. I am certainly excited about what's going on today in the presence of God. And when I say I'm excited about what's going on in the presence of God, is that He is with us along with persons who He has prepared to work in different capacities with regard to health, wellness, and the wholeness of life, and all those things that cause people to move away from where they are in fear to where they need to be in understanding, comprehending what's going on, and knowing that this is certainly not the end of the road, but this is a bend within the road. And so we have talked to you about churches reopening and what they should prepare for, and they should not go in accordance with what somebody says, but they need to look at the data themselves and see what's best for them, making sure that they're prepared to get back into church buildings, making sure that everything is safe for those people who come, not necessarily being in a hurry, but on the other hand, not operating in fear because they feel they should either come to church or should not come to the church building. But there are a lot of things that's going on in our society that has nothing to do with the coronavirus. On the other hand, some of it has to do with the coronavirus. Irrespective of which it is, we need to prepare ourselves for our tomorrow. And the one way that we can prepare ourselves for tomorrow is to hear from people who have involved themselves in the study so that they have understood what needs to be done, what needs to be said, how people should react to what's going on. And I have such a person here today, Dr. Sheila Peters, and she's a clinical psychologist. She practices here in Metro Nashville. She's also works with the NFL Titans and department head at Fisk University. We're just glad to have her with us today to share with us on some of the things. Dr. Peters, I am certainly happy to have you with us today, and I am sure that you have involved yourself in so many things that have been helpful to people, period. And so why don't you tell us something about yourself?
Thank you, Bishop Maynard. It is a privilege to be here and to be able to share with everyone. Certainly, I am a licensed clinical psychologist, but I am a local pastor in the United Methodist Church. And so I lift up today that it's important for us to take care of ourselves, physically as well as mentally, as well as spiritually. And so there is a tremendous need for folks to have a spiritual community where they can grow into who they are, but also with their concerns, with their fears, to have a safe space where they can discuss their emotions and learn coping strategies. That can happen within a faith community. It also can happen out within the professional community. And I think wonderful partnerships with counselors, with the spiritual community is a model that more of us need to look toward.
Very good. We have been discussing how to bring faith and let it merge with medicine. And they don't have to be diametrically opposed one to the other. And I appreciate the fact that you brought that up and the fact that you are pastoring a church. So you know in today's time where the thought process is for men. We have to be very careful, I'm sure, as we project. I do believe that God calls us, and it's amazing you've been called into two callings. One, in clinical psychology, you've been called there, and I believe you have been. And then you've been called into what I consider to be the word ministry, or the ministry that addresses itself to the spirit of man. And so you got to have both approaches. We have heard a lot of things, Doctor. People are running afraid. They're fearful. Should I come out? Should I not come out? What will happen if I touch this, if I touch that, or somebody speaks to me? How do we address that from the clinical aspect as well as from the spiritual aspect?
Well, absolutely. I think from a clinical aspect, when we deal with COVID-19, we understand that this unprecedented time then is another trauma on top of other traumas that people have experienced. So COVID-19, our social isolation, people being sequestered, not being able to come into their faith community, not being able perhaps to have lost their job or having to work from home, that they have to adjust to that and develop different coping styles. Some people, including myself, haven't spent this much time at home in a long time. So they are rediscovering some things about home. But this process that the health professionals have advocated for us nationwide requires us to be still and to calm down and to protect ourselves. If we were already experiencing a trauma, then the social isolation might make it worse. So it is important, and I know there are tons of people that either for their spiritual community, for other activities, and certainly for work, may have been on more than enough Zoom calls. There's research going on now that talks about Zoom fatigue. That's a completely different way. Our attention is very different. When you're in a face-to-face meeting, and every now and then it could get a little boring. You can do some different things, but if you're on a Zoom call, you have to maintain your attention. And people want to know, I'm at home, why am I more tired now? Because it's a completely different routine. When we talk about going back into society, people are going to have to be prepared. People that were anxious are more likely to be even more anxious now. So they've got to be prepared when they go out into society, how they're going to function in that way. In terms of coping strategies, we really got to, there's some real basic things. Get plenty of sleep, take care of your physical health, but also your spiritual health. Just knowing, be still and know that I am God.
Yeah.
And allow yourself to get a perspective. I think many people, and there are lots of people that are writing and talking about it, and I'm so grateful that you all are doing this tremendous service to the community. That is that this should give us, even though it's extraordinary times, an opportunity to take a new assessment of our life. How have we been using our time? It's some stuff I still have to do. It's still some hurdles that I or anybody has to go through. But should I reprioritize my time? You know, I kind of like my family.
Sure.
I've spent a little bit more time with them. I see why I like them. So how do I incorporate that in what will be our new normal? So many of us psychologically want to return. February 2020 is not coming back again. Many of the people, the things that we're doing may be there, but how we do it is going to be different, and we have to be prepared for that.
Well, Dr. Peters, you were saying something that I was about to say, and you just covered it, and that is, be still and know that I am God. And that's what people need to do to understand that although these things happen in our lives, it doesn't mean that God sent them. That does not mean that at all. But one thing he does when things happen, he becomes involved as an architect and then orchestrates and brings us to a place where we ought to be and takes these opportunities for us to learn, as you so well placed it with regard to what we do at home now, contrasting what we used to do. Most homes were places where you might eat and you might not, or you do sleep, get up early and you're gone and come back and do the same thing over again. So there are a lot of things, and people have questions, and I believe that they have questions of you. And so if you would take time at this point and answer some of those questions that have been posed to you.
Absolutely. One of those questions really has to do with the whole notion of coronavirus and how we might respond as individuals psychologically. And as I mentioned earlier, it means that one trauma might be layered over another trauma. One of the horrific, and there are lots of horrific things about what's been going on, Bishop, is in the sad event that someone should lose a loved one, or even in the process of them being ill, people cannot be with their loved ones. And so when we talk about frontline or first line responders, they often, through a phone or some mechanism, allow that loved one to be able to communicate with their family. But we have seen, particularly in New York and other places where people have died and their families have not been able to really go through the burial ritual and really the grieving. So for many people who have lost someone already, their grieving has been interrupted. And so it means that when things return to where we can be out in society and resume some of our typical activities, they're going to have to start that grieving process all over again. And clearly the faith community is going to be crucial within that. Certainly funeral and that process is important, but it's also helping people to deal with that loss. The loss of how our society has changed. And what we are learning, and we're learning stuff every day, is that people who have survived, their bodies are still compromised. So they may be, some of them may be going forward with other kinds of physical conditions. What we know about that is how we physically feel can affect how we feel mentally. And so I want to just encourage people, telehealth is wide open right now. Your physician can work with you through telehealth, but the same thing with counselors. Counselors can provide that. That's relatively new to me. That's not where my training has come from, but I'm working with people. I've only known them through telehealth at this particular time. Everybody needs a safe, non-judgmental place where they can talk about what they're thinking in their head. This is scary. What's going to happen? I'm in that older group. Should my grandchildren come over to see me? Are they going to remember me? Is my job going to still be there? And unfortunately, with our national politics, you can't get any more assurance sometimes when you watch a press conference there. But it's really allowing people to know that they need that support and that counseling is available. What I want to share with everyone about that, we understand that we need to go for a checkup. And I know that we still have people that are not covered with health care. But counseling is not nearly as expensive. Most health plans have a behavioral health component where you may be paying, if anything, a small copay to go and see a counselor. But because we say, I'm not going to pay to just go and talk to someone, well, we spend, and I'm not putting physicians down, but we may spend a few minutes with them. They give us a prescription, certainly out of their expertise, and we go on with that. We have a certain expectation. I think when we talk about people just talking to us, we think that somehow it's different.
Yes.
Yeah.
Yes. Well, and you talk about what's happening. Is it not amazing how we adapt to different situations? I mean, we're spending more time in conversation with Zoom, teleconferences, that we would not have done before. But it's helped us to understand that I don't have to be right physically in your presence in order to get done what should be done. Now, we do know that many businesses have told people, you don't have to come in 5 days a week. You come in 1 day a week or 2 days and stay home and do your work 3 days. That was some time ago a beginning of where we have progressed to, I think. This does not mean that we will not go back to where we were to some extent, but we have at least proven that we can do. And the one that really gets you is the church, the virtual, that people are coming to church, but they're coming to church at home, coming to church in their robes with a coffee cup in their hand and a donut on the plate saying, preach, Pastor. But that is a norm of which we need to become accustomed because it's not going anywhere. It's going to be there. Did you have another question that was asked of you?
Well, I think one of the questions, particularly within the African American community, is what is our resistance to what years ago was called mental illness, then mental health, and I choose to, along with the research, to use the term mental wellness, that we are trying to understand how we think and how we operate. Within the African American community with COVID-19, within brown and black communities, we're seeing people that they don't have a higher propensity of catching the disease, but if they do, their health outcomes are worse, that they may have a higher mortality rate. Our government hasn't figured out what that is. Certainly there are scientists, sociologists, and other researchers that talk about institutional racism that has existed. For years we have known, long before the opioid epidemic, that if people of color come into the emergency room suffering with pain, that sometimes, not always, health professionals will interview them but won't give them medicine because there's a stereotype that they are seeking medicine for other reasons.
Sure.
But and I use it as an example, this nation right before COVID-19 was dealing with a large segment of white citizens that had received that medication in abundance, often from different providers. So what we can see, and I am not calling any individual racist, but it's a system where when people of color seek help, people start looking at our motives, and when in fact other people come, they can have full access to it. The other thing, and I just want to throw this out, a counselor is somebody that can really help you to feel safe in a space that you can work through different issues. For people of color, about 2% of all psychologists are people of color. Certainly there are social workers. There are people that are very talented at the master's level that can also do counseling. It is important for many people sometimes to have somebody that's out of their own cultural background to help them. That's the way you get started. But in the long run, that counselor still needs to know how to help and assist you. So if we study, if we have diabetes, if we have some other kind of medical condition, therapy along with sometimes medication will help you with depression, will help you with anxiety. And if you already have that in your family, it's a great likelihood that this situation has really brought that up within you. And we just want people to know where they can get their services. So.
Sure. You know, coming up as a child, I've been in church almost all of my life since I was 5. And persons who had problems with health, wellness, from a mental perspective, what we did at that time, I can remember them having people at the altar calling what they say casting the devil out. You have the devil in you, we're going to cast the devil out. So churches have had a tendency for a long time. I'm talking about, and I don't want to stereotype, but I might be talking about Pentecostal churches more in particular. They would utilize the power of prayer and say, we have control. And if there was a member in the church who was not faring well mentally, they would, to some extent, disassociate themselves and or deny that presence was there. And people will feel very uncomfortable, one, in coming, and two, having their relatives to come to that kind of an experience. I think that we have relaxed tremendously with that kind of attitude today, and I believe that churches today understand more fully that there are things that you don't have to have cast out. They need to be addressed in a way that God has given to us the opportunity to address them. I want to give one more thing, and I want to get your response. I was praying. I was in a revival. I had just turned 41. And I opened the Bible, and all of a sudden, the words in the Bible were not as clear as they have been. And so I was trying to read, and I'd hold the Bible like this and like that. So when I got back to the hotel that night, I said, "Now, God, I want you to touch my eyes so that I might be able to read." And later on, after I was up, later on, I found that the words were the same. My eyes had not been touched. I went down to the drugstore, and got some reading glasses, and my eyes were touched. So the point is, God has made possible for us to have help
Absolutely.
from persons who he has given the knowledge and the wisdom and the understanding and the willingness to study so that we can be helped. How do you respond?
Well, of course, I agree with that. I think that we have to use all the tools that we have. And I certainly want to say that counseling or therapy itself is not a panacea, but in the work that I do, and I am really listening to someone's story as they come in to seek help. When I look at their social support, and there are a lot of people that are isolated that don't have a lot of folks that they can depend on, but people that have a relationship within a spiritual community within a church, that's a tremendous amount of support. They may still be depressed. They may still need to come into therapy, but I know that they have. And oftentimes that will be a part of how they begin to heal is, yes, to participate in therapy, but also allow their friends and their support system to participate in ministry and do the kinds of things that they need to do. That is because part of therapy is changing the way in which we're thinking about the way in which we've been managing things. And certainly God is the master healer and can handle all things. But we also need to be about helping him in that process. He doesn't need our help, but we don't need to sit back and just say, okay, God, you do all of this, but I will have the faith while I also do the kinds of things to get myself in the best place. One, to serve you, but to also be well in my thinking and in my living.
Yes, and you know, God invited us into his community. Absolutely. And he did so after he equipped us. Everything we needed to do what he wanted us to do, he gave to us even before we were created. and so that being the case, there's another a point that I want to just hit on just a bit before we close this out. And that is, it's my understanding from some people that people are staying home more today than they had before. They're interacting with each other more than what they had before. But in some homes, it's creating a problem. All of a sudden, they're discovering who they really live with. How do you, from a church perspective and also from clinical psychologist perspective, how do we address that? Because it's happening everywhere.
And I think it goes back to part of what we've been talking about: the mental illness, the challenges, depression, anxiety. It's going to still be there even in the midst of COVID-19. Some of the statistics say that domestic violence reporting is going up, that there's a higher prevalence for child abuse. And so part of what we know that we need to do is to provide a safe space to encourage people to get the kind of help while they're still sequestered, but also churches and communities providing a safe passageway for people to get. We are going to be in a kind of post-traumatic stress as a collective community when we are really coming out. You see some people coming out, some people say it's politically motivated, but some people coming out just to rush back into normality. What I want to say from a church perspective and from a psychological perspective, respect each other. I might not think, not myself personally, but I might not think that I'm going to catch it, but wear a mask so that while you're out, you're protecting the other people. Let's be respectful. Here in the South, we're supposed to be people that speak to folks, have good hospitality. We're going to have to redefine what hospitality means so that we can take care of ourselves. Because the reality is this, right now as we speak, the numbers are still going up in the South. The numbers are going down in New York and other places where we've had such unbelievable death. But we don't know if we're going to have a downtime before the fall or if a second wave will come through. But the way in which psychologically we want to push back out and get back to doing what we can do, I just remember it hadn't been that long ago. A horrific event, 9/11, changed the whole way you get on a plane. A young man right around that same time, trying to light his tennis shoe, potentially to blow up the bomb and sacrifice himself, is the reason why we have to take off our shoes when we get on the airplane. So there are going to be lots of different ways. Learning, I think, a lot of my time is also spent, and I'm blessed to be at an institution of higher education. Online education was something colleges were trying, in a lot of cases, initially to recruit that older student who's already working full-time and has a family. But online education may be something that we're going to have to deal with. There are a lot of institutions that have older faculty. We have to figure out, maybe some faculty members will have to teach online because they don't want to compromise their health. Sure. So there are a lot of things that are going to change, but at the same time, we all need to be appreciated. We all need to have a safe space where we can grow and nurture. We all need to be in a spiritual community that can help us build our relationship with God, as well as do the great work that your congregation and so many other congregations do.
Amen. Amen. I believe that you've answered these stressors can be detrimental to our health. How can we relieve the stress? I believe that you addressed that particular question that we had of you. And we do appreciate greatly the fact that you are here with us today. This is how do we mesh faith with medicine, and I believe that you have done an excellent job of explaining to us the methods by which we could use and the manner that we use in order to accomplish that particular goal. I should not look at you because you have learned the particulars of psychology and I haven't. but I can look at you in your profession, both that's ecclesiastical and also that addresses itself to science. All right. So we're glad to have you with us today, Dr. Peters. We appreciate greatly. And once again, I want you to tell the people who you are, what you're about, and we'll move from there.
Thank you so much. It's been a privilege to be here. Again, I am Sheila Peters. I'm a professor of psychology at Fisk University. I'm also a licensed clinical psychologist, and I am proud to be able to work with children, youth, and adults. I also am the team clinician for the Tennessee Titans, and every NFL team now, since last year, has to have a comparable position. And more recently, I have been serving now for 2.5 years as the pastor of Braid Memorial United Methodist Church in East Nashville.
Well, Dr. Peters, we certainly are appreciative of your being here. You have given to us a lot of information for which we are pleased and thankful, because not only is it good for us in this forum, but it's also good for those who have been listening to us to apply to their lives. So next week, we're looking forward to being here at 6 p.m. on Sunday. And the Dr. Jerry Maynard II will be with us, and he's going to talk to us about the importance of health in our communities, not only as it relates to our physical person, but our mental person and our spiritual person. So you want to tune in at 6 p.m. to hear that discussion, and I know that it will be wholesome for all of those of us who participate. Thank you again.